and we do not turn anybody away.
Is that right?
No.
Wow. Well, now
Right.
what's just so a family member knows, or so a family knows, when we talk about it's virtually available to everybody and is free through, as you laid out those different sources, who would be some people that it would not be available to? I mean, that would have to turn to your nonprofit foundation.
If they did not have Medicare, Medicaid, or private insurance.
Okay, so
We could pull in our foundation, and our foundation will even help people that are in dire need to pay their utility bill or whatever,
Wow.
or bill ramps or whatever.
Right.
And that's another plus for being a national company. I mean, we're pulling in from all over the country.
Right.
Our foundation deposits over $1 million a year from donations and profit and whatever.
That's tremendous. So
Right.
there's an opportunity even for viewers to be involved in supporting that foundation.
Oh yes. Mm-hmm.
Okay, great.
Right.
They could do that at your website,
Right.
or even call in your office.
Right.
That's tremendous. You mentioned volunteers, Carole. Are there active opportunities available for volunteers? And what are some of the things they would do?
Our volunteers are angels. We couldn't do it without them, and the families are so appreciative too.
Yes.
For the volunteers, they go out, sit, read, talk, listen, minor house chores, sit while the family runs errands. Just they bond with the patient and the family,
Right.
and all of our volunteers are so dedicated, and they love what they're doing. In fact, my youngest daughter is one of our volunteers, Blair.
Is that right? And she is assigned to a different family, or will stay with one particular family?
She may be assigned to more than one, but she'll stay with that one patient until. And it's all when we lose the patient, it's always so difficult on the volunteers because they become bonded and such good friends.
What would be some of the criteria needed, some of the criteria that your daughter obviously displayed for someone to be able to volunteer for Compassionate Care Hospice? What are some of the...
She's just Blair's very compassionate. She's loves the elderly. In fact, all my daughters, I've got 3 daughters, all my daughters are science oriented. I've got one that's a nurse, a RN, BSN. And then my middle daughter's a doctor.
Yes.
She's in Augusta doing her residency. She and her husband both are doctors. They got married down in Merle's Inlet last summer.
Yes.
And then Blair. Blair works at Creek Rats.
Yes.
She loves her job at Creek Rats.
Bartender of the Year a couple years ago.
Yes, she
very
was.
popular.
She was.
Yeah,
She
national
knows. I
recognition.
think she knows everybody in Merle's Inlet.
This is a great area. We're in Merle's Inlet
I
now,
love
right
Merle's Inlet. Yeah. But she's very compassionate and just wanted to help. She wanted to give back to the community and help those that are in need, and that's what it's all about.
Anything you're doing, really, as you said, your 15 years of hospice care, or being involved in the industry and supporting families, it really is a helping role.
It is a great organization, Greg. I mean, it is great. I get frustrated sometimes when I'm out there and people don't know about it. I mean, hospice has been around since the early 70s in the United States. It was started in the modern day hospice.
Right.
Actually, hospice has been around since the 11th century, but the modern day hospice was started in London, England, and came to the U.S. in the early 70s.
Some of the most common misperceptions that people might have about hospice would be what? What are some of the things you mentioned?
Some of them think it's a financial burden,
Okay,
which we
Clearly
determine it's
dispelled.
not.
Right.
A lot of physicians think they're going to lose that patient, and I run into that daily visiting the physicians. A lot of them think they're going to lose that patient. That is a myth. That primary care physician becomes part of our team.
Okay.
We want them there. We want them to know what's going on at all times. In fact, we have a team meeting every other Friday, and I take all the minutes and the notes to that physician, and they're welcome to join that team meeting if they so desire.
Right, right.
But no, they are part of our team, and we certainly appreciate it. It's an honor for us to take care of their patient, an honor, and we want them to be part of our team.
That's wonderful. So that it should not be a concern whatsoever by any primary care physician.
No.
does a family need to wait for if they think their loved one might be terminally ill? Do they need to wait for the doctor to make that referral, or can they just?
No.
Okay.
No. Anytime they think they need help and their
Right.
family member is terminal, mention it to the doctor.
Okay.
So what about hospice services?
Right.
And of course, it's a patient choice. There are a lot of hospices. It's patient choice, whether you're in the hospital or not. You're presented a list of hospices, and it's patient choice. But you know, you have a right to tell your physician or the hospital which hospice you prefer.
Tell real quick about the admission process. What does the admission process involve, Carole?
We get the referral. It comes in either by phone. A lot of times a physician will call me, and sometimes the physician wants me to go out and talk to the family. The family may be leery. They think hospice, oh, my loved one's going to die tonight, and that's not the case. Oh, it's just a different kind of care. And we've released, as I mentioned before, we've released patients that got better. But that referral comes in, and we go out and meet with the family and the patient, make sure they're appropriate. And then the orders come in from the referral doctor.
Right.
The orders come in. We go out and make sure everything's in order and they are appropriate. And we admit the patient and we go over everything with the family, and then we order the equipment. All the equipment's taken care of, and the medications. And then we schedule when the social worker and the appointments, the nurses and the CNAs will go out.
And all of this opportunity enables folks to stay in their own home and not have to leave their home. Is there some specific assistance that's provided in the home, or is it particular to each patient?
Oh, each patient has their own care plan, and it calls for different care. And when I go out to speak to community organizations and civic organizations, I always tell them, Greg, when we're born, we're surrounded by family and loved ones, and don't we deserve the same when we leave?
Those are great words. Yes, Carole. Those are great words. Speaking of that, do you make yourself available to go out to speak to groups? If there's a viewer watching right now who may think this would be perfect for some of their friends or other folks in their development or their retirement facility, or would you be able to go out and speak?
That's what I love to do. I love to go out there and spread the word and tell people how they can get help. There's help if they need it.
That's wonderful.
And so, I love
Okay, so if a viewer wanted to call the 843-448-7107 number, they could do that to get to line you up to come speak.
I would be more than happy to.
That's tremendous. So you were dealing directly, Carole, with not only with the public writ large in these 4 counties and throughout the state, dealing with the interactions that happen on a statewide basis with y'all's licensure last year, but also dealing with families directly.
Right. It's very rewarding.
Yes.
It's just wonderful. I mean, I just feel if I've helped in any small way, it's just very rewarding.
We've just got a minute, Carole. Does Compassionate Care Hospice, or any hospice provider, but particularly Compassionate Care Hospice here, provide any support to the family after the death of their loved one?
Yes, we are available, working with that family up to 13 months after the death.
Really?
And we work with individual bereavement support. We also have group bereavement support meetings. And they are scheduled throughout at different locations.
That's tremendous. Carole, what is the best part of working with Compassionate Care Hospice for you?
For me is working with the families that need the help, and when everything is said and done, they look at us and say, we couldn't have done it without you.
Right.
We couldn't have done it without you. Wish we would have had you sooner.
Yeah, I bet that is. That's wonderful. Well, thank you again. Stay tuned for a little more All American People with Carole Bowdre, Compassionate Care Hospice, coming up next. You know, we ran out of time. We didn't get to talk about Carole's very special husband, her 3 grandchildren, and her wonderful son-in-laws. But we did have an opportunity to talk about the mission of so many folks that work in hospice service and providing this tremendous care, and it's a very special mission. I want to get this out. The mission is to bring comfort to suffering people with life-threatening or chronic illness by bringing them physical, spiritual, psychological, and social care. It's a tremendous mission. Wouldn't you love to be in this? Wouldn't you love to be a part? You can be by volunteering, whether for compassionate care or so many other wonderful hospice providers in the area. But take the time to go online to cchnet.net or give them a call at 843-448-7107. That's 843-448-7107. You can be a part of making a difference in the lives of others. Carole Bowdre, thanks again for being with us.
Thank you.